Session 11. This is a big one because it's a big subject, because this is on nutrition, and that subject's got bigger and bigger and bigger as we've gone along, and more now is known about nutrition, that the gut, it's got its own brain, about the gut microbiome. There is so much out there, and hopefully you've been looking some things up because you're interested in the body and nutrition and what it does, and so you've probably got some ideas anyway. And but this is going to open it out, and yeah, so here we go. I'm going to share the screen so that you can see that I'm looking in the student area, Reflexology, session 11, and it tells you to complete all the worksheets before the class as usual, please, and to read the Ruth Whole book on the digestive system and the boxes. You're still doing the boxes, and so then it'll be the digestive system. And so really those boxes are getting more and more filled now, and your knowledge is growing and growing and growing. And as you do your case studies, that's where you'll learn more and more and more. So there's going to be a reflexology test, a genitourinary worksheet, digestive nutrition worksheet, basic diet and nutrition, and the reflective practice as normal. So looking at this Eat Well plate, that used to be the thing that was given, and it still is given in some areas. And so is this still right? No is a short answer to that one. And I just want to go up here at the top of this page. It's in the student area, and you've all got this, and it's got the answers for session 11 to download. So please take these and download them, because later on within this chapter here that you're going to be answering questions, and they've got the answers to it. What I'd also like you to do before that lesson is listen to the podcast where Dr. Chatterjee is talking to Professor Tim Spector, who is a professor of genetic epidemiology at King's College London, and is a leading expert on the gut microbiome. And his work has transformed what we know about health and nutrition. And he blows out of the water some of the myths that we've been told about health, and what we eat. So please have a listen to this. We owe it to ourselves, our families, and our clients to really know what's going on in the world of health and food in particular, because that's something that we all do, isn't it? Eat, and we need to know. We're not going to be nutritionists, but we need to know and be doing our best ourselves for us and our families, so that then we can pass on information. Maybe give your client, say, oh, listen to this Dr. Chatterjee podcast on nutrition. Advise them to read the 4-pillar plan. That's all good basic stuff. So nobody has to set themselves up as an expert, because it's all there, and we can refer to the experts and say, these people, listen to them. So let's get on with this. It says this will be completed in class, but you want to do this before the class, so that you can really take an active part in it, and it's not all just a surprise, and you've had time to think about it. So one reflex other than the bladder that you might work on for cystitis. So first of all, what is cystitis? Cystitis is an infection of the bladder, and that's not where you feel the pain usually. but that's what it is. So you would obviously use the bladder as a reflex, but there are other reflexes. You could use the ureters and the urethra, for instance, and the ureters, and also I would suggest the adrenal gland. The adrenal gland, because that is producing your body's own cortisol, the steroid, to help with pain and inflammation. So pregnancy is less likely to occur if a woman suffers from endometriosis. Why might that be? Well, so then you need to know what endometriosis is. I expect most of you know anyway. And it's where the lining of the womb grows outside of the womb. And it can grow in different parts of the body, not just slightly outside the womb. One of our graduates, her daughter had it all up here in her chest. And she was in dreadful, dreadful pain because it shouldn't be there. But what happens as regards pregnancy is that often the lining is blocking up the fallopian tubes. So we've got the fallopian tubes where the egg travels along. Well, it's all bunged up with the lining, and so it can't get through. Very, very distressing and painful condition. Reflexology might be able to help, and the reason is that it could be a hormonal thing. So we're helping to balance the hormones, and also it's relieving pain, because one of the things that reflexology does, if you remember right back in the beginning, it normalizes function. So if we can give reflexology to help normalize function of the body can actually help to right itself. There isn't a guarantee, but if the body's given the right relaxation, it's a bit like a plant really. You give it put it in a nice soil and you plant it and you water it, it's going to do well. So it's really helping the body in that way. You know, we don't actually make the plant grow, do we? We put everything in place and then it grows. Well, that's what we're doing with reflexology. We're putting things in place and the body can then right itself. A client presents with symptoms of endometriosis. Choose one of the complementary therapies in the list that might benefit the client. So have a look, choose what you think. Acupuncture, you might have had acupuncture, and but it would be good to look these up, and so you could Google acupuncture, endometriosis, aromatherapy, endometriosis, and see what Google comes up with. Aromatherapy can help with, there are essential oils to help with pain, hormone balancing, relaxation. There's an oil for absolutely everything to put together, so that would be a good one. That's the one that I would know most of all, but I would look up on the others. You might know about homeopathy. I put out on the Our Health Matters, there's a free homeopathy course for family. So if ever you see anything like that, so always a good idea, because it expands your knowledge. Even if you're not going to use it, you would know to refer people onto it so that you feel more confident. And osteopathy. Why would osteopathy might help? And that might be a surprising one for you, that osteopathy could help with that. So see what you can come up with. Years ago, one of my client students, we were talking about osteopathy and the back and getting things in line. So I know chiropractors deal with the back and osteopaths do too, but sometimes if the back's slightly out, the nerves going to those areas can't work properly. And so that it might be an adjustment that's needed, a mechanical adjustment that's needed to get around there. I was talking about this sort of thing in the class. One of the students started looking into it because she hadn't fallen pregnant with the second child, and the other child was getting older and older, and she went to an osteopath and blow me down, she got pregnant. So be careful what you advise people to do. So here we are. Some key facts from a client consultation sheet. So we've got a female, 41, newly married, no children, wishes to start a family, concerned about possible infertility, qualified as a secondary school teacher 12 months ago. There's a lot packed into there, very short thing, but that tells us a lot. So have a think. 2 other items of medical history that the reflexologist would need in order to help address this client's concern. So what would you think of asking her? Well, one of the things that you would ask every client is, when was the last time they went to the doctor? So have they been to a doctor? Also, another question could be, have they been to another therapist? They might have been to, we don't know, anyone to find out. So it's always best to find out. And to tell you something, if you find out that they've been to a lot of different therapists, then just beware, because they are looking, sometimes they're looking too much for you to be the answer, but sometimes people are looking for people to fail as well. I know that sounds awful, but they go from place to place, and so be careful not to take things personally if things don't work out in the end and it's all tied up with a nice bow at the top, because their lifestyle is so important, and them working along with it. So this tells us a lot, but there's a huge backstory. There's a whole novel behind there. Suggest at least 2 benefits of reflexology that a reflexologist might tell a client to help address her possible infertility. Well, one of the benefits is, as we said earlier, about balancing. It normalizes function. And so that's one of the things. It's going to help to balance the hormones and help to de-stress her, because she's obviously going to be stressed. She's newly married and concerned about infertility, and she's qualified as a secondary school teacher, so she's got all her balls up in the air, and so she needs some relaxation, which you can offer. What should the reflexologist suggest as aftercare or home care advice for this client? Well, I'd certainly recommend that she looks into some relaxation techniques. You could recommend, if she hasn't done any meditation, a meditation app. She might like a meditation app, she might not. We have meditation coming up on our, we've got plenty of meditation videos actually on our Health Matters group, and they could use those, or she might like an app. Meditation does an awful lot of good things, breathing techniques, for instance, to help her. You need to find out what she likes, but she might be someone that would like to take up maybe yoga or something like that, because she definitely needs something that's going to de-stress her and take her out of this anxiety that she's in. She may not be a yoga person. I'm not a yoga person, so it could be something else that would appeal to her. So something that she would enjoy, that takes it out of herself. I would also wonder about a nutritionist, because the nutritionist plays a really big part in fertility, and for the male and the female, because it takes 2. So here we are. We've got a a table here to complete. They've got a condition with us that's blank, with excessive thirst, a trigger, lack of insulin. I think that's quite a big thing, isn't it? One reflex area that, so we're looking here at diabetes, aren't we? And there's type 1 and there's type 2. Type 1 is something that you're born with, and they would normally need to be injected with insulin. Type 2 is often dietary related and lifestyle related. I'm sure it's not always, but in the main it is. And the reflex area, one reflex area is the pancreas. That's where the insulin is produced. I would also think of the solar plexus as well, because people that are diabetic are often very uptight. And I remember one of my friends years ago, her father was diagnosed with diabetes, and fortunately the clinic at the time invited her to come up there to speak to them, the diabetic nurse, and they were told how it can change, like the personality, when their blood sugars are low and they get very angry. And it really took a lot of stress out of the whole family, because it explained a lot why her father was as he was, and they became more understanding. So it's not always known, these side effects, and so it's good to know about these things, because people can not be very understanding if they think that they're people just being awkward. So here we have Jean Smith and her medical history: type 2 diabetes, which is the one that's food and lifestyle related. She's stressed and she's got adult children. She sleeps well and she walks a dog twice a day. So she's active. So why would we need the following information from Jean, her dietary habits? Well, diet has got a lot to do with it. And there are now cookery books and dietary books, which I would recommend. And somebody once, he rang me up and he said he felt that I'd saved his life. I thought that was a bit of an exaggeration, but he'd been diagnosed with diabetes, and I told him about the book. I can't remember the name of the book at the moment, and it was so well known at the time. And he read the book, and he no longer reversed your diabetes, and it was a simple changes to his diet. He lost a lot of weight, and he didn't have any trouble, and he could come off the meds that the doctor told him. He didn't just come off it, and the doctor was surprised. So you need to know her dietary habits, and then you could see from there if it was something that if you could recommend the book, and if not, maybe she'd want to go to see a nutritionist. But what she could gain from her reflexology treatments is that relaxation. It definitely isn't going to do the trick without the lifestyle and the dietary advice going hand in hand. It can't work on its own. It's a whole package. It's holistic treatment. And often people, if they're coming to someone and they're paying for treatment, they will listen and take that advice. So what answer would you give? Can you make my diabetes better? Well, the answer is no, because we can't guarantee anything, and we can't claim to cure. That's one of the things. So we wouldn't say that. Say this may be help. This has helped a lot of people. Give it a go. If they said, can you give me anything instead of my tablets? And the answer would be no. That if they then followed the dietary guidance that was in the book that you recommended, then the doctor would work along with them, and they go for regular tests and blood tests and what have you, and the doctor would tell them whether or not they could come off the tablets. So you need to do this before class. Migraine affects about 10% of the population. It's often triggered by substances such as caffeine. Name one other dietary subject. So another dietary substance, and there are loads of them. There are loads of dietary, and you probably know one, because that might be you. Oranges is one. Oranges is one. Yeah. So it's finding the right one, and that's why often when a client comes in, and a food diary is really good, and if they just left off oranges, say, they say, oh, I eat 6 oranges a day, and then they say they've got migraines, think, oh, I wonder if it might be the migraines. Why don't you leave it off for a week and see what happens? And it's just a suggestion, isn't it? Other than diet, state 2 causes of triggers of a migraine. Well, you know what that is, don't you? Stress and hormones. The time of month can have a big impact. There's 2 signs or symptoms that distinguish migraines from headaches. Quite often someone with a migraine will be able to feel it coming on, and they feel like an aura, something that you couldn't explain unless you've experienced it. So if you haven't experienced it, then it's not a migraine. And lights would affect them, and they'd have to lie down in a dark room, because light affects people with migraines. So a client presents with a history of migraines related to caffeine. State one other effect of caffeine on the body. Well, it speeds up your metabolism, and it gets you going. So that's one of the effects of caffeine. State one recommendation other than not to drink coffee that a reflexologist might make to this client. So other than not drinking coffee, a recommendation might be to switch to a nice herbal tea that isn't caffeinated either. So hopefully that's something that they might like. And a recommendation could also be to do some hand reflexology on themselves, that on the solar plexus, winding around the solar plexus, and they could do that to help their stress levels. I think the food diary would definitely be one that I would recommend. And to maybe the meditation, or thinking of taking up a hobby, walking, something that gets them moving, gets their mind off of their problems. This is all sorts of things, really, because it might be lots of different reasons. It might be the coffee exacerbated by the stress. Name one reflex that should be worked on for this client. So this is the one with migraine. So I would say the brain, because that's where it's emanating from. And the good old adrenals again, because that's where the pain and inflammation help come from, the body's own cortisol. So also the digestive system, because if that's where if it's digestive related. It is a big subject, the migraine one, and that's Kerry, who used to teach reflexology for me up until quite recently. She went to a bone therapist. She went to a bone therapist for, have you discussed about the different therapies yet? But bone is one of the ones that was on your list to learn about. And she was telling me that she'd gone to a bone therapist to help with her tennis elbow. But it didn't actually help with the tennis elbow, but what it did her migraines. She was having weekly migraines with a lot of medication. And she went to a Bowen therapist who did what the Bowen therapists do, very gentle and non-invasive. And her migraine stopped. Yeah, she hadn't gone for that, but that's what happened. So that must have been stress related, unless it was the hormones that were balanced, I don't know. But if it had been food, obviously it would have come back again, wouldn't it? Okay, now the next few sheets from page 6 are the answers are in the handout that you draw down from the top here. Nutrition answers for 11. So reasons why the body needs food, the basic components of a balanced diet, why fibre is important, minerals are important for bone growth and repair. And while we're looking at that, thinking about the minerals for bones, we know that the minerals are needed for bones because we've got the vitamin D, isn't it, that we take in, and to help with the calcium, because that helps us make calcium. And the bones are built with calcium. Calcium is an alkaline. If your body needs alkaline because your blood is getting too acid, your body will take the alkaline out of your bones to normalize your blood pH. So once the calcium's in your bones, it doesn't stay there. It can come in and out through the blood system, which is why some people end up with osteoporosis because of the bone density. But I thought that's really interesting though, isn't it? To know that it doesn't stay in there. So with the wrong diet, the calcium will leave the bones and go to the blood. So it's really important for both bone growth and repair. Food that contains iron, and of course now that we've got, when you're pregnant, there's certain things that you can't eat that contain iron. So people of my age have to be careful about what we say about iron because it's changed for pregnant women. Common food that give rise to sensitivity or allergic reaction in some people. Well, there's a list that goes on and on and on. There's like a 3-column list to choose from in that help there. And nuts is obviously one of them. Nuts is an allergic reaction because that's when they have the anaphylactic shock and they have to have the EpiPen. Sensitivity is if you maybe oranges and it aggravates your eczema or something like that. But sensitivity is one thing. Being allergic to something is something much, much more serious. So you look at the day's intake of food with this breakfast and lunch, and it's why it's nutritionally unbalanced. And I'd like you to use that handout because it will help you to get the words right. Instead of saying it's a rubbish diet, it'll give you the wording to use. And And the next one that looks fine because it's all nice and crunchy and salady, why this one might be considered nutritionally unbalanced as well, and that will give you the proper, well, what was considered then to be a proper reason, and put yours as well. You might be a nutritionist for all I know. So why is fresh fruit important in the diet, and why are refined food considered bad? There's lots of information on that in there, and why we often advise clients to reduce their coffee intake. And there's a couple of columns to choose from in there too. So have a look. And conditions that may be associated with food allergy and food sensitivity. There's lots of conditions there that to do that as well. Yeah, so then you'll have a test. You've got the hand chart and the foot chart. Hope that's not making you dizzy when I do that. And yeah, hope that helped, and that you'll get on with studying that up. And then when you see the tutor, whether it's by Zoom or in the classroom, you're going to have a really good discussion and bring out all the points that you want to. So make your own notes as well on things that you've learned, especially on that podcast as well. So have a listen, and we'll see you soon.